Cancer. Care for your mouth. Some cancer treatments can cause problems with your mouth and teeth. These problems may make it hard to eat, talk, chew, or swallow. If untreated, these problems can lead to changes or pauses in your planned cancer treatment. They may also affect your quality of life during or after treatment due to pain or poor nutrition. Treatments such as chemotherapy and radiation work by destroying fast-growing cancer cells in your body. However, some healthy cells may also be damaged, such as the cells in your mouth. This can cause injury to your mouth and slow down healing. Before you start your first cancer treatment, you can do some things to lower your risk of these problems. Ask your cancer doctor, called an oncologist, to share any mouth and teeth side effects that may happen with your treatment. Make an appointment with your dentist at least 4 weeks before you start cancer treatment. This gives time for any needed dental work to be done before your first treatment. To keep your mouth as healthy as possible, see your dentist to treat your cavities, gum disease, or to smooth jagged teeth which may rub and cause sore areas in your mouth. Some cancer treatments may also increase your chance of bleeding, so it is best to have any dental work done before your cancer treatment. It is also important that your dentures fit correctly to prevent mouth irritation. If you have braces, they may need to be removed during your cancer treatment to prevent cheek or tongue sores and possible infection. Give your dentist the name and phone number of your oncologist. They may need to work together to care for your mouth and teeth. You should not drink alcohol or use any type of tobacco product. Use of tobacco can slow healing in your mouth after dental procedures or from cancer treatment side effects. Your dentist may suggest special mouthwashes or fluoride treatments to help strengthen your teeth, especially if you are to have radiation treatment to your head and neck. Fluoride trays can be made for you to use at home to apply fluoride gel to your teeth. This should be done before your cancer treatment starts. Eat healthy foods such as fruits, vegetables, grains, low-fat or fat-free dairy, and protein such as lean beef, skinless poultry, and fish. A dietitian can suggest foods that you enjoy and meet your body's needs. Eating a healthy diet can help you feel better, stay stronger, maintain your energy, fight infection, and rebuild damaged tissue. The dietitian can also help you find ways to manage eating and drinking problems that can be caused by treatment. It is important to take steps to keep your mouth and teeth clean each day. During cancer treatment, there are actions you can take to feel your best. These include: weigh yourself each day and report changes to your oncologist. See your dentist regularly and update them on your cancer treatments. Ask your dentist to talk with your cancer care team about any needed dental procedures. Some of these procedures may need to be postponed until your cancer treatment ends. Tell your oncologist about any changes with your mouth or teeth as soon as possible so they can be treated. Changes to report include mouth sores. These look like ulcers that form on your inner cheek, tongue, gums, lips, floor, or roof of your mouth. These sores can happen from some chemotherapy medicines or radiation to the head or neck area. If you have mouth sores, keep your mouth moist by taking frequent sips of water and sucking on ice chips. Do not drink fluids that are acidic, like orange juice or cranberry juice. Other fluids, such as soft drinks, sports drinks, and water with added vitamins, can also cause changes to your teeth. Do not eat hot, spicy, or crunchy foods, such as potato chips, that can irritate your mouth sores. Your doctor may order a pain-relieving gel, prescription mouth rinse, or special mouthwash that you can make at home. These can help form a protective film that numbs the sores in your mouth. In some cases, other types of pain medicine may be needed. Dry mouth is another problem you may have during cancer treatment. This happens when you are not able to make enough spit, also called saliva. Saliva is needed for taste, swallowing, and speech. It also protects your teeth. If you do not have enough saliva, plaque and tartar builds up faster on your teeth and increases your risk for cavities and gum disease. A dry mouth can cause thick saliva, thirst, a constant sore throat, burning on your tongue, trouble speaking, cuts or cracks on your lips or corner of your mouth, changes in the surface of your tongue, hoarseness, difficulty swallowing, problems with wearing dentures, or dryness in your nose. Saliva also works to protect the healthy bacteria in your mouth and to wash away any pieces of food left on your teeth. Without enough saliva, unwanted germs can grow in the mouth and lead to infection or mouth sores. Sugar-free candy or gum can help if you have a dry mouth. Try to drink at least 8 glasses of water a day. Artificial saliva or saliva substitutes may be needed. Oral gels or other medicines may also be helpful. Do not use petroleum jelly and glycerin products. Your doctor may order a special mouth rinse to help lubricate your mouth before eating. Use of a humidifier may help moisten your nasal passages. Stay away from things that make your mouth dry, such as soda, fruit juices, tobacco, caffeinated drinks, and alcohol. You may also have problems with sensitive gums. Some types of chemotherapy can cause tenderness, bleeding, or swelling of your gums. Your doctor may suggest medicine to put on your gums or a steroid mouth rinse to decrease swelling. An antibacterial or antifungal mouth rinse may also be ordered. Jaw pain and stiffness can happen after radiation to the head or neck area. Radiation treatments can cause swelling and scarring around the jaw muscles. You may also feel pain in and around the ear, pain when biting down, or headaches. It may even become hard to open your mouth wide enough to care for your mouth and teeth. Stress can also lead to teeth grinding, which may cause jaw pain. Treatment may include medicine and facial exercises to help relax the jaw or to treat swelling. Use of a protective mouth guard may help with teeth grinding, especially at night. Taste changes may happen with certain types of medicine, chemotherapy, or radiation to the head or neck. Foods may have no taste at all or taste different, especially with bitter, sweet, or salty items. Do your best to eat healthy foods to help improve your recovery from your cancer treatments. A dietitian can offer tips to overcome some of these taste challenges. Infection in your mouth can happen for different reasons. Some cancer treatments lower your body's ability to fight infection, so steps should be taken to prevent and treat infection as soon as possible. Infections can be caused by bacteria, fungus, or a virus. Medicines such as antibiotics or steroids may also increase your risk of certain infections. An infection in your mouth can look like a sticky, white film, a sore, or you may see swelling or bleeding. Your oncologist may order antibiotics, antiviral drugs, or antifungal drugs to treat your infection. Bleeding in the mouth can happen when chemotherapy or other anti-cancer medicines cause the blood to not clot correctly. Bleeding can be mild or more severe. It is important to be gentle when cleaning your mouth and teeth during this time. Your doctor may suggest medicines or mouth rinses to help with bleeding. Here are some ways to keep your mouth as healthy as possible during cancer treatment. Brush your teeth gently, at least 4 times a day, especially after eating and before bedtime. Brush for 2 minutes each time. It is best to use an electric toothbrush. Carefully brush where the teeth meet the gums and rinse often. Don't forget to also brush your tongue. Use a soft bristled toothbrush and replace it often. Soak your toothbrush in warm water for about 30 minutes before use to soften the bristles. You may want to use a child-size soft toothbrush if your regular toothbrush is too bulky. Let the toothbrush air dry between brushings. Only use a foam brush if you are unable to use a soft, bristled brush. It is best to use toothpaste with fluoride and a mild taste. Some flavors can irritate the mouth, especially mint. Your doctor may suggest a special toothpaste to soothe your mouth during cleaning. To prevent your mouth from becoming dry and irritated, do not use over-the-counter mouthwash with alcohol. Anti-cavity fluoride rinse is recommended. Rinse your mouth often with water, at least every 1 to 2 hours while awake. Rinse, swish, and spit several times after brushing or flossing. This helps keep food off your teeth and gums and lowers your chance of tooth decay and infection. It is also important to rinse after vomiting to keep stomach acids from damaging the enamel on your teeth. Floss gently with waxed floss at least once a day. You may also find it helpful to use a water flosser. This helps remove plaque between your teeth and prevents cavities. If your gums are sore or bleeding, call your dentist. If your platelet count is low, your oncologist may have you stop flossing until your platelet numbers improve. Take care of your lips by using water-soluble, wax-based, or oil-based lubricants to prevent dryness and cracking. Put the lubricant on after cleaning your lips. If you have dentures, brush, rinse, and soak them every day. Your dentist will suggest the right denture cleaner and soaking solution to use. When you are not wearing your dentures, keep them moist by placing them in water or soaking solution. Empty and clean your denture cup every day. If your mouth is very sore and tender, you may only want to wear your dentures for eating. Do not wear dentures or partials overnight. This may cause sores or a fungal infection called thrush. At times, problems with your mouth and teeth may happen after treatment. It is important to keep them as healthy as possible. You may find tooth decay has begun or that your mouth is drier than before. Your teeth may have become discolored from certain mouth rinses or medicines. Radiation to the head and neck or use of some medicines may have caused damage to your jawbone. Regular dental treatments, such as cleaning and polishing, may need to wait until your immune system has had a chance to recover from your cancer treatment. Your dentist will need to check with your oncologist before any dental procedures, such as removing a tooth. If you wear dentures, they may need to be adjusted to make sure they fit correctly due to changes in your mouth. Things that were once easy before cancer treatment, such as eating, drinking, and speaking, may be harder. This may cause you to feel frustrated, withdrawn, or depressed. You may find it helpful to talk with a professional counselor about your feelings and to help you manage the changes caused by your treatment. Remember to call your oncologist if you have mouth pain, if you are not able to eat or drink, if you have a fever or any sign of an infection, if you have bleeding that is hard to control, or if you have any new problems with swallowing. We hope this information has helped you better understand why taking care of your mouth and teeth are important when you have cancer. Write down any questions you might have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.